Welcome to the Beverly Hills Plastic Surgery Podcast. I'm here with my favorite co-host, Dr. J. Calvert, and we are here today to talk about something I wouldn't say it's near and dear to my heart, but it does get me going, like not in a good way. So, dear
That's
listeners,
the understatement of the day.
bear with me. I may get a little hot under the collar on this one, because just listen, just wait and see. Dr. J. Calvert, tell me your story.
So on a Saturday morning, I get, and thank you, by the way. I'm happy to be here.
As my most favorite co-host.
Absolutely. Well, we're coming up on 250 episodes, by the way.
I know.
Okay, just want to put that out there. So on a Saturday, I get a text from a patient of mine who, in the past, had butt implants. And she had some problems with them, which we took care of, and I hadn't heard from her for a while, really since the pandemic. Mm-hmm. And she sends me this text that was disturbing. It was like, "You're the only one that'll answer me on a Saturday. I'm having problems. Something isn't right. I need this filler dissolved. I had it put in my butt, and it's not going well." So right away, just for the listener, filler in the butt is unusual because there's no filler in this country that you can really use to do a butt augmentation.
Right. We'll get to what's acceptable.
Right.
But just as a preface, that's not normal.
Right. And so I'm already like, what do you mean you got filler in your butt? Yeah. Like, who did that? So I'm start thinking right away, she's sick because it's some foreign substance that maybe they brought it in from out of the country. Maybe they've got a trial going, something.
Something's wrong.
But something's not right. And she can't get a hold of her
injector,
we're going to say, because it wasn't a doctor. And so I say, well, what's going on? She says, it's so painful. I can't take it anymore. You've got to dissolve this filler. And I said, well, I can meet you at the office. And, part of me was like, well, go to the emergency department. But she said, when I talked to her, she'd already been to her, I don't know how to put this. She'd been to Kaiser Permanente. That's how I'll put it.
It's a hospital group.
Yeah, twice that week, and they've sent her home on antibiotics and steroids. So she was on clindamycin and steroids as prescribed over the phone, because the first time she went in, they said, there's no problem, go home. And then the second time she called, they didn't see her. They talked to her on the phone and said, here are your steroids and your antibiotics. So she comes to me on Saturday morning, and I say to my wife, hey, can you come with me and just, help me out? Because, and she's in nursing school and stuff. So, which is what you do for retirement, which is what my wife is doing. She's going to go into injecting and into being in the Medi-Spa and, probably doing some emergency room stuff, knowing her. But so she's like, sure, I'll come over with you. So we go over and we meet up with my patient, and she can barely walk coming in the door. She limps in. She's in obvious pain. She looks, and this is a term we use in medicine, toxic. Mm-hmm. She looks ill. She looks like something is so wrong here.
Yeah. You can see them from a mile away. They are sick, actually sick.
And she is sick as hell.
Yeah.
So I bring her into the exam room, and Chris is there with me, and we lay her down, and what I see is this massively swollen butt cheek. And she said she only did it on one side because she couldn't take it. She said it hurt so much when it was going on that she's had to stop. She has 2 ports on the side of her butt cheek on the well, I'm not going to say where, but just on the side. And then there's a mass that is probably, 20 centimeters across, red, hot, painful, ooze on the skin, and she's febrile. She is sick. This is somebody that is going down in a ball of flames.
Yeah.
So I tell Chris, I said, we got to open this. I'm not going to send her back to her, medical providers, because they've sent her away twice. And so I know what needs to be done. Whatever's in there doesn't need to be out. It doesn't need to be dissolved.
It needs to be let out.
It needs to be drained.
Yeah.
There's clearly an abscess.
Yeah.
So I prep everything up, and this is, again, on Saturday morning in the Rock Spa in Newport Beach, and into it I go with the knife, a 15C, by the way, just for those of you following at home. And out
Spurts.
before you could actually process what, and this was my wife too, before we could process what we were smelling, it was gut-wrenching. It was like you could feel that you're about to heave. Like you could feel your gut just like, it's before you can even know that you're smelling something terrible.
Rotten.
Your body retches.
Yeah. And that is a very known smell for anyone that's done any kind of general surgery specialties. When you have something dead in the body, something massively infected that is not alive and not good, it is a very distinct smell that will literally curl your toes and it can make you vomit. It is a awful, very distinctive smell, like something is not right here. Horribly wrong smell.
And out comes fluid that looks like poop, like a stool.
No way of putting it.
It just is like, it's dead, it's anaerobic smelling, it's nasty. It's so bad, and I realize I'm going to be draining like a liter from here. So now, now it's game on. So
half a Coke bottle, people.
Yeah. So 2 alcohol wipes into our nostrils. 2 into mine, 2 in my wife's nostrils. And we just got this thing drained. And it was awful. And my poor patient was ready to blow chips also. But we get it all out, wash it with some saline. I do like basically what I can do in the office for her.
Yeah.
Pack it. And, I start asking her, like, what in the actual F happened here? What was injected? Who did this?
Yeah.
How did this happen?
How are they not taking care of you?
Start talking because something
is rotten.
Is really
very rotten.
Really
literally.
Rotten. Yeah, I mean it was awful, and so I packed her up, put a dressing over it. I put like a telfa-tegaderm over it so that it would be sealed from the fluid, and it was packed with gauze. And I said, when you go to the emergency room and I sent her over to her Kaiser people. I said, when you get there and you are at the front desk, I want you to remove this telfa-tegaderm so that this odor lets them know that you need to be admitted to the hospital. Yeah. You don't need to be sent home with more steroids and antibiotics.
Yeah.
And she did it, and she got admitted, and she was in for 10 days.
Whoa.
IV antibiotics, PICC line, debridements at the bedside.
Gosh.
Debridements. I don't know if she went to the OR, but
that is a long time to be in the hospital.
She got home and she's doing better now.
Yikes. Okay, I have so many thoughts. Okay. Let's start with.
Why don't we start with a woosah, and like just from a woosah,
because we haven't even gotten to the best
we're not
parts.
even there.
Who did this?
So it's a injector.
That's a very loose term.
Yeah.
That's not what she is.
She's an esthetician.
She's an esthetician. What do you learn in esthetician school, Dr. J. Calvert?
Mostly how to provide, skin treatments.
You learn how to wash faces.
Okay, it's a little more than that, but you can do.
You know what you don't learn in esthetician school? Sterile technique, injections.
I get it. I know. It's unbelievable.
Okay.
And she's not an esthetician from our state.
Okay.
So she turns out she's an esthetician from Atlanta.
And what is this person's name? I will tell you.
I don't know.
Because I looked her up. Because this has me going bonkers. And I will lay out all the reasons why. This lady, I'm having it on my phone because I wanted to get this right. She's from Atlanta. Her business is called Dream Body Studio. And her name is Mickey Takira. And if you look her up on her Instagram and her website, she looks like she's very well known. She's been on some TV. She does this. She does that. I don't know how she ended up in California, but she's not licensed to be out here, number one.
She doesn't have a California license?
Okay, so in the state of California.
Because I have a lot of experience with the barbering and esthetician board, cosmetology board.
In the state of California, estheticians aren't even allowed to do microneedling because it's breaking the skin and it's an injection. Not even allowed to do microneedling. This is I don't know how it is elsewhere, but in the state of California, you can't just come in with an esthetician's license and start injecting people. You can only do what you are trained and licensed to do. So that's the first thing. That's assault and battery. That is a criminal offense because she is practicing outside of the scope of her training. So at its most basic legal level, it's wrong. But let's go back to the actual practicalities of why this is wrong. She's an esthetician who has not been trained to do any of these things. That's number 2. Number 3, this is where it gets really upsetting to me because we don't know what she's injecting. I scoured her website and all I could find were options and prices. Do you want 200 cc's injected? Do you want 400 cc's? Do you want 800 cc's? And this is how much it cost. Not a single mention in any of her posts or on her website what the hell she's injecting. So let's talk about what the actual options are for injecting in the butt. Gold standard, fat. You put fat in the butts all the time. There's some issues with that, but that's not the point. You put fat in butts. That's a very good option. Or you do small volume injections of things like Renuva, which is synthetic fat. It comes in 1.5 and 3 cc vials, and it costs about $1,500 for one of those syringes.
It's crazy.
So if you're putting in 200 cc's of Renuva, that's easily $100,000. That's not how much she charges. The other thing that goes in butts is Sculptra. Similar in amount,
and works.
Similar in price.
And works.
And it works.
It does. It's expensive, but it works.
3 cc thing of Sculptra will cost you several $1,000s. So guess how much 200 cc's would cost you? A lot of money. The synthetic injectables you can put in the butt, Renuva and Sculptra, are very small volume. They don't have a huge, massive effect. You're not going to get this massive volume from them.
No.
And they are super expensive. Those are your options for the butt.
Now, in other countries, there are large volume hyaluronic acids
Yes.
that you can inject, and I used to do that in Dubai. And they are also designed for large volume injections. They're less expensive per syringe. They come in 20 and 30 cc syringes, but still, you can wind up spending $20,000, $30,000 trying to do 300 cc's of injections.
Easily, because they cost a lot of money. So that's the problem. What is she putting in that she gets in volumes of 200 cc's and is not on the order of several $100,000? So that's huge red flag number 13, that we don't know what she's putting in and she doesn't advertise what she's putting in. She's not trained to do any of this. And then the other question, as you kind of alluded to just now, is where is she getting this product from?
Right.
Because
that's right.
In order to order any of the things we just mentioned, you have to be a medical practitioner, you have to have a license, right. You have to prove all these things to the legitimate American companies before you can purchase from them. I've been trained, these are my degrees, these are my qualifications, this is where I practice. And so God knows what she's putting in and where she's getting it. I'm going to stop for a minute. Your turn.
Okay.
Go.
I know you can keep going.
I got all night.
Okay, so this is like a common thing especially around Southern California, because people want the result, they just don't want to spend all the money.
Because it's expensive.
So how much was it for 200 cc's?
I don't remember. It wasn't a lot.
Like
a couple thousand, something like that.
Was it really
Yeah.
that much? And my patient had 2 cannula port injections. So it was injected by cannula. So that means that's practicing medicine without a license for sure.
A cannula is a thicker version of a needle, but it's
Right.
almost more of a surgical instrument because it's way bigger than a needle. So yeah, something's being injected and we don't know what it is.
And so to get that kind of volume, typically the things that you can buy, there is industrial hyaluronic acid. You can buy large tubs of it.
And where does that usually go?
I don't even know what it's used for.
Into a machine
I don't
to
know what
grease
it's for.
We don't know.
It's
not meant to go in the body.
No, it's not. And like there was a practitioner out in I don't know where she is today, but I've had a few patients from the desert out by where Orden and Chopra and Nate practice that had silicone injected, like engine silicone into their lips. Which is probably also what's happened to some of the celebrities around town that we know. Lips by Lucy was that practitioner. And it just, would rot out of their lips because it was engine silicone. It wasn't medical grade silicone. By the way, it's against the law to inject medical grade silicone into the soft tissues of the face and body. The medical board would not be happy with that either. So she's got to be injecting something that's industrial, that comes in large volumes, that's cheap, doesn't belong in the human body.
In the human body. And certainly not placed there by someone who has never been trained to do that. And so this is one very concrete example of this kind of practice, but it is happening everywhere. And it is so proliferative, and that's why I'm so hot and bothered by it, because we see it all the time. I bet if you took a poll of every single plastic surgeon in this country, every single one of us has seen one of these back alley injections performed by somewhere. And when we're on call, we get called to the ER to deal with the rotting silicone in someone's butt or, whoever, this implant in someone's face. It is fairly ubiquitous, and it drives me up the wall because it's not being injected by doctors or practitioners or anyone with any kind of legitimacy. These are back alley shysters, conniving con artists that are out to make a quick buck, and they don't care what they do to that person because they've never taken any code of ethics. They don't have any board to answer to.
No.
They didn't go into medicine because they cared about taking care of people. They could give a damn. They are there to take your money.
Absolutely. And if we called the medical board about this practitioner, it'd be like, well, what's their license number?
Oh, wait, they don't have
a license. And the medical board goes, we're out.
Nothing we can do.
Right. And if you call the esthetician board, oh, what's their license number? We're out. You call the health department, like, oh, what facility is she in? We're out.
Yeah. There's no one regulating them except for the DA.
You could call the DA. You can call the police
DA.
and make a police report. That's about it.
Assault and battery.
That's it.
This is an awful complication, but it can get worse.
Well, she was going to die. Let's be clear where this was going.
If you had not intervened, 1,000%. And you can die from sepsis, and you can, and here in Los Angeles, women have died from having silicone injected into their
100%.
butts that went into their lungs in a back table in someone's garage. You can 1,000% die from these procedures.
And I'll tell you, the thing that's, everybody worries about like these, the BBLs, the Brazilian butt lifts and the fat.
Yeah.
Because the veins of these large gluteal veins and sacral veins are right there, and they are a direct line to the inferior vena cava, which is the big vein that goes right back up to your lungs. And so if you inject fat into those veins, it goes to your lungs, and you have what's called an embolus, and that's it. That's the day. Your dream of a big butt ends along with everything else that you have.
Right. And that can happen in the hands of extremely practiced, skilled, board-certified plastic surgeons. And it has happened. And these are people who are at the top of their game in terms of how they've been trained. So imagine what could happen in the hands of someone who's had nowhere near that level of experience and training. A story that I had that was similar was several years ago. A patient who did have fat injected into her butt, but she went to a medical spa, a medi-spa, because that's where you usually have surgery. She went to a medi-spa, and the medical director of that spa here in Southern California was an internal medicine doctor who did a little bit of liposuction on the side and thought he would get into fat grafting, because how hard could it be? So he took his liposuction box, and then he tried to inject it into her butt. Didn't know where he was going, didn't know what he was doing, clearly had no sterile technique because it's a medi-spa. Like how can you possibly get these instruments sterile enough? She ends up in the ER 2 weeks later, septic, in the ICU, about to die from infection. Her entire butt is necrotic and falling off. Went to the OR multiple times with general surgery, and they had to debride her whole butt. And that just meant cutting out pieces and fat. And what she was left with, she was a buttock cripple.
It's like a nub.
I've done probably 8 or 9 reconstructive surgeries on her now, and she's now in a place where she can wear spandex and go to the gym and look normal, and no one's going to look twice. But it was a long road, and she nearly died because she will admit it. She went to someone who gave her a cheap price, and she just didn't know what she was getting into. And here's the even crappier part about that story. When she tried to sue him for whatever happened, he was dropped by his insurance company because when he applied for privileges, he was told by his malpractice carrier that he had malpractice for liposuction. And they gave him a letter that said, we are not covering you for fat grafting because you are not trained and qualified to do that. So she could have sued him, but she would have gotten no money.
For what?
Because he had no malpractice for what he did. So this is the take-home. Why are we doing this whole podcast?
Cautionary tale.
Cautionary tale. But let's make it educational. If you were thinking about having anything injected into your buttocks or any other part of your body, what do you look for? What do you not look for?
I think you got to look for a board-certified plastic surgeon. That's who does this.
End of story.
That's it. I mean, like
we could stop right there, but we'll continue.
I mean, you want to know that you're going to somebody who's been trained to do it. I mean, even Mr. Nosefest over here does BBLs. I'll do this procedure. I call it the skinny BBL because my patients
They're
get
so
they get 200 cc's. I mean, except for this patient, which was an outlier for me in that stand. For everyone, I think, but it is it's really important that you go to somebody that does this, who's good at it, and who understands the mechanics of how to build your butt from fat or from Sculptra.
From injections, yeah.
Yeah, I mean, I do Sculptra injections for my patients. They work great. I have amazing results with that. Sculptra is great. It's just really pricey.
It's not $2,000. That'll get you one vial.
Yeah.
Yeah.
No,
maybe.
It's less than that. Is it that much?
Yeah. Something like that. I think a vial's like $1,000, $1,200. Yeah. It's not. Yeah, it's expensive. So
and this plastic surgery is killing me. I can't afford it. I'll just go with my flat butt. It's fine. That's enough. But realistically, it is important. You look for the certification. You look at how many of these do you do. Just go to somebody who knows what they're doing, please. I mean, estheticians can't inject in California. They can in some. I don't know if they can inject, but they can do like microneedling in some states.
In some other states,
they can do like in Nevada. They can do lasers.
Yeah.
In Nevada, they're good to go. The estheticians can work the laser machines. They can inject Botox. Like every state is different.
Has different things.
So what you search is, Medical Board of Texas, esthetician practice, scope of practice.
Yeah, and so that's a good place to start. Ideally, you would be having a surgeon do this. If not a surgeon, a doctor. But please more a surgeon, because as I just explained to you, internal medicine doctors should also not be injecting fat. Please go to a surgeon. Just go to a surgeon, a plastic surgeon.
What about an internal medicine doctor that does a weekend course on fat grafting?
Nope. It's not enough. It's not enough. To a board-certified plastic surgeon.
That's our opinion.
Don't even go to a dermatologic surgeon. Go to a plastic or cosmetic surgeon. I'll give a shout out to my cosmetic surgeons there. Plastic or cosmetic surgeon. Someone that does this routinely, that was trained to do it, that knows what they're doing. Do not get your butt injected by a nurse, by a PA, by an esthetician, by someone whose credentials you cannot find. So number one are the credentials of the person injecting you. Number two, ask, what are you injecting in me?
100%.
100%. And if it's not fat, Sculptra, or Renuva,
move along.
Get out of there. There's nothing else in America that you could put HA fillers like Juvederm or Restylane, but it's so
it's temporary. And
it's temporary. It goes away. It will cost a ton of money. That's why we don't do it. That's why you use the longer term options like Renuva or Sculptra.
I want to be clear about one thing though. This is our opinion, based on the licensing of the state of California. Anyone with a medical license can do this.
Absolutely.
So this is our opinion. We believe that you should go to a plastic surgeon, a cosmetic surgeon that's been trained to do this, that does a lot of them. That's just our opinion. When you get a license in the state of California, people, and this is for everyone,
a medical license,
yeah,
a doctor.
When you get an MD license, you are now licensed to practice medicine and surgery in the state of California. Mm-hmm. And all you need is a 1-year internship in anything.
You don't even have to finish your residency.
You don't have to do a residency. You just have to do a 1-year internship, and you're off to the races. If you want to hang a shingle and start doing surgery and doing butt injections, brain surgery, sinus surgery, if
you want to read radiology films,
100%.
Deliver babies, you can do any of that.
You do whatever you want. Now, whether you'll get facility to let you do it or get malpractice coverage or get someplace that'll let you do these things, that's another story.
Which is why you have to ask, do you have privileges at a hospital? Because a hospital will absolutely make sure that you have done the appropriate residency and you've done the right number of cases before they will let you onto their staff and onto their premises to do that surgery. The amount of paperwork we have to provide to hospitals just to get privileges there.
It's insane.
And they go all the way back to like your high school graduation diploma. Like they really look into it to make sure that you are qualified because it's a big risk for them too if you're not. So hospitals, if you're doing a surgery in a hospital, that surgeon's been vetted. If you're doing it in a certified surgery center like we have, those surgeons have also been vetted. If you're doing it in some shady back alley or garage, probably not. And as the case of my patient showed you, if they don't have malpractice to be doing that procedure, then it means that they're not qualified to be doing that procedure.
Yeah, all these things are adding up so that you can understand, like, just go to somebody that's reputable and has
And if you just go to a board-certified plastic surgeon, you don't have to ask any of these questions.
No, that's true. It doesn't mean you're going to get great results, but at least you know that they're credentialed and they should be able to do it. So, yeah, I felt terrible for my patient, and it was a tough way to reconnect with her from that standpoint. I was really sad for her, and
it's awful.
Yeah, it was, and
10 days in the hospital.
She's got kids, and like she's an awesome person, and just really sad. And I thought my wife might quit her nursing degree at that point, but she hung in there. I was like, "What do you think?" Our office was like, it was awful.
How did she find this patient or this injector person?
Instagram ads. Yeah, so it's from the gram, and I don't know all the details about where she got it done and all that, but it was pretty like it was like a red flag sandwich she was eating on this one. Like you can't.
There's so many things. There was nothing right about that story.
Yeah.
At all. Yeah. So, don't come into our city and start injecting our patients and expect to get away with it.
No, and I don't know. Cool. I don't even know what she's going to do about it, quite honestly. I think that I don't know. We'll find out. We'll follow up and we'll let everybody know. But it's like I can't imagine that there's really much recourse other than making a police report that this is what happened to me.
It is. It is a police report.
The police may not do anything about it either. So it's like that's why education is the beginning. You got to educate the patients that you need to know this stuff. It's really
just don't. I understand that plastic surgery and treatments are expensive. I do.
Are they ever?
But please be really careful when you're looking for that discount procedure because there's a reason things are expensive because you're buying products that are expensive because they've been regulated by the FDA because you're going to someone who's been trained.
Yep.
All of that costs money. So if the deal seems too good to be true, it probably is.
I agree. I think that's all we got for this one.
I think that's it. Okay. All right.
Woosah. That's good.
All right, folks. This is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.